Do you know what a peptic ulcer is and how it can affect you? Peptic ulcer disease, often referred to as PUD, is a common medical condition that affects millions of people worldwide. It's a condition where painful sores or ulcers develop in the lining of the stomach or the first part of the small intestine, known as the duodenum. Now, you might wonder why this is important. Well, while peptic ulcers may seem harmless, they can lead to severe complications if left untreated. They can cause internal bleeding, perforation, and even lead to a blockage in the digestive system. Understanding peptic ulcers is crucial because they're not just a result of stress or eating spicy food, as commonly believed. Several factors, such as bacterial infection and certain medications, can contribute to their development. Now that you know what a peptic ulcer is, let's dive deeper and understand its types. There are three main types of peptic ulcers, each with its own characteristics. First up, we have gastric ulcers. These bad boys develop on the inside of the stomach. They are often caused by a bacterium called Helicobacter pylori, or H. pylori in short, and sometimes by long-term usage of non-steroidal anti-inflammatory drugs, known as NSAIDs. Moving on, we have duodenal ulcers. These are formed in the upper part of the small intestine, specifically in the first part known as the duodenum. Similar to gastric ulcers, H. pylori and NSAIDs are the usual suspects here too. However, these ulcers are more common and are often linked to periods of stress. Lastly, let's talk about esophageal ulcers. These ulcers develop inside the esophagus, the tube that connects your throat to your stomach. They're usually the result of some form of acid reflux, where stomach acid backs up into the esophagus, or from excessive alcohol consumption. It's important to note that each type of ulcer can cause different symptoms and complications, and therefore may require different types of treatment. For instance, gastric ulcers might cause pain shortly after eating, while duodenal ulcers might cause pain when the stomach is empty. Esophageal ulcers can cause pain when swallowing. Knowing the type of peptic ulcer can help in understanding the symptoms and treatment. But remember, it's always crucial to consult a healthcare professional for an accurate diagnosis and appropriate treatment plan. The symptoms of peptic ulcers can vary depending on the type. For instance, gastric ulcers, which develop on the inside of the stomach, often cause pain shortly after eating. This pain might be described as a burning sensation in the middle of your stomach. On the other hand, duodenal ulcers forming in the upper part of your small intestine typically cause pain that appears several hours after eating, often during the night. This discomfort is frequently relieved by food or antacids. Finally, esophageal ulcers occurring in the lower part of your esophagus can cause pain when swallowing, particularly with hot or acidic foods. It's crucial to understand that these symptoms might present differently in different people. Some might experience severe pain, while others might feel only mild discomfort or even no pain at all. Recognizing these symptoms is the first step towards getting the right treatment. To confirm a peptic ulcer, healthcare professionals perform certain tests. You see, diagnosing a peptic ulcer isn't a guessing game. It's a process that involves specific laboratory and radiological tests. Laboratory tests are typically the first step. Here, a blood, stool, or breath test can reveal the presence of Helicobacter pylori bacteria, one of the leading causes of peptic ulcers. It's crucial to pinpoint this bacteria to determine the root cause of the ulcer and guide the treatment plan. Radiologic tests, like an endoscopy, come next. This procedure allows doctors to get a close look at your digestive tract. A thin tube with a light and camera at the end is inserted down your throat to inspect your esophagus, stomach, and small intestine for any ulcers. Biopsies or tissue samples can also be taken during an endoscopy to further examine the ulcer. These tests are important to confirm the presence and severity of an ulcer. Once diagnosed, the treatment for peptic ulcers can begin. Peptic ulcers are treatable and manageable with the right approach. When it comes to treatment, there's a variety of options available, and the best choice will depend on the specifics of your condition. One common treatment for peptic ulcers is medication. This could be antibiotics to eradicate H. pylori bacteria, proton pump inhibitors, or histamine receptor blockers to reduce stomach acid, or even medications to protect the lining of your stomach and small intestine. It's important to take these medicines as prescribed by your healthcare provider and to complete the full course of treatment, even if your symptoms improve before you've finished all your medication. In addition to medication, lifestyle changes can be a vital part of managing peptic ulcers. This might mean avoiding foods and drinks that cause your symptoms to flare up, such as spicy foods, alcohol, and caffeine. Smoking can also exacerbate ulcers, so quitting is highly recommended. In some cases, when medication and lifestyle changes aren't enough, surgery may be necessary. This could involve removing the ulcer, tying off a bleeding artery, or cutting off the nerve supply to the stomach to reduce the production of stomach acid. Following your treatment plan is crucial to managing your peptic ulcer effectively and preventing complications. Remember, your healthcare provider is your partner in this journey, so don't hesitate to ask questions or express any concerns. While treatment is crucial, prevention is always better. Preventing peptic ulcers involves understanding the risk factors. These include excessive use of pain relievers, smoking, heavy alcohol consumption, and untreated stress. By managing these factors, you're already on the path to prevention. Regular exercise, a balanced diet, and good stress management techniques can go a long way in keeping your gut healthy. But what if you suspect you already have an ulcer? Well, if you're experiencing persistent abdominal discomfort, nausea, vomiting, or unexplained weight loss, it's time to see a healthcare professional. It's also crucial to seek medical advice. If you find blood in your stool, or if you're vomiting blood, these could be signs of a complicated ulcer. It's important not to ignore these symptoms. An untreated ulcer can lead to serious complications like internal bleeding or perforation. So, don't hesitate to reach out to a healthcare professional. Remember, early detection and treatment can prevent complications. Peptic ulcers can affect anyone, but with the right knowledge, they can be managed and treated effectively. Let's quickly recap what we've learned today. We've discussed that peptic ulcers are sores that form in the lining of the stomach, small intestine, or esophagus. We've explored the three most common types, which are gastric, duodenal, and esophageal ulcers. We've delved into the various signs and symptoms, which can range from burning stomach pain to bloating and nausea. We've outlined the importance of various diagnostic tests, from laboratory tests to radiologic tests, for accurate diagnosis. We've also emphasized the significance of timely treatment and management, which can include medication, lifestyle modifications, and in some cases, surgery. Lastly, we've underlined the importance of prevention, early detection, and when to consult a healthcare professional. Remember, knowledge is power. Stay informed, stay healthy, and always consult a healthcare professional if you suspect you have a peptic ulcer.